Nursing is a tough, demanding job in the best of circumstances. But for the past year plus of a global pandemic, which has turned many hospitals into battle zones and killed more than 540,000 people in the U.S. alone, tough and demanding don't even begin to cover it. With growing workloads, frequent deaths of patients, and daily risks to their own health and safety, many nurses and other healthcare workers have been grappling with immense stress, fatigue, and emotional trauma. These are the issues at the heart of a new podcast created by Labouré College of Healthcare in Milton and William James College in Newton, which specializes in psychology. It's called Unprecedented: Nursing in a Pandemic. And my next guests were featured in the first two episodes. Shana Curran is a traveling nurse who's worked 3 COVID-19 contracts since last March. And Dr. Jenny D'Olimpia is a licensed mental health counselor and the assistant chair for the Counseling and Behavioral Health Department at William James College. Thank you both for being here.
Thanks for having us. Thank you for having us.
Shana, let me start with you. What has your experience professionally been over the course of the past year? What are the contexts that you've been working in, and what has that been like?
So primarily all of my COVID assignments have been travel nurse assignments. So I was on an assignment in Colorado when COVID first started. That contract got cut early because of COVID, and then I ended up out in Boston. And it was March, the beginning of COVID, the first March that it was here for. And it was high stress, unknown circumstances, unknown everything. I kept saying, like, every day things were changing, and every day we got new information. It was different than anything I've ever been in. I've only been a nurse for now coming on 4 years. So it was something that was just every day changing, every day new information, seeing large volumes of patients that are extremely, extremely sick, ICU overloads, not even having the availability, and then obviously the number of deaths. I even worked hospice before, and I've had people die, and I'm very comfortable with end of life. This was just something we never were prepared for as nurses or in nursing school, and nothing against the schools I've gone to and attended. It was just something that we weren't used to. It was a new experience. No one really knew how to prep you. And then following that assignment, I went to North Carolina and did assignments down there, also COVID assignments. And it was just still, everything was new and changing. And the information you were getting was changing every day. You kind of didn't know how to be the best nurse you could be. And I think every day we go to work trying to be the best we can, trying to provide the best. And no matter what we did, we saw these negative outcomes. And then growing and learning. I mean, it's the last year has just been such a learning opportunity for the healthcare field, for everyone in general. I mean, even the non-healthcare population of learning about COVID, but especially in the healthcare profession, just learning everything we can, trying to do every case study we can and getting best practice out there. It's been a tough road to learn during.
I wanted to ask you as a follow-up what the hardest part has been for you, but I feel like you might have started to answer that question already. Am I right that from what you just said, the hardest part is not having a clear roadmap for how you're supposed to do your job in this particular moment in time?
Especially as a traveler, like I do really well. Give me an A to Z list. If this occurs, this is what I do. I'm not used to what you typically do at your facilities. I have to go off of what you tell me. And there wasn't an if A occurs, go to B. It was like, I joke sometimes, but I'm like, it was like you know what, shoot, like just who knows what's going on, what's best practice. And then knowing that like your decisions are causing illness and eventually death. Like I was in PCU settings, so patients that were critical still went to the ICU. So I still had somewhere to place them, depending on what type of care they were receiving. But it was just, no matter what you did, it might not have been right. You didn't know if it was right. And then you sent them off to the ICU and you hear weeks later, like all these patients you've had that are passing. And I think it was very difficult. Like I went to school to help people. I went to school to be a nurse. I even talk in the podcast, like I like bedside nursing. I want to touch my patients. I want to physically be with them. And number one, having patients just taken from you because they're too sick, they go to the ICU. And then also not knowing what job you should be doing. Like as a job title of nurse, you know how to provide care.
Yeah.
You didn't know what to do next. You didn't know how to care for them. And then they're just being sent off to the ICU for my patients. And we all know the statistics, like they're real. And it was very difficult having my patients have to go somewhere else. And then it was even more difficult learning the next week, like, oh, that room's available. And I'm like, well, what happened to John Smith?
Yeah, I would think that'd be incredibly difficult. Jenny DeOlympia, what was the genesis of this podcast? What made you decide and the other people behind it decide that this was something you wanted to put out into the world?
Well, as a school of psychology, we're very concerned with people's well-being, and we wanted to do something to help. So at first, we sort of tried to start doing, we offered some online Zoom, like group crisis intervention or support for nurses. And we didn't find that nurses were available. They were too busy taking care of people. And they didn't have the time available to take care of themselves in order to go to these groups. So we were in communication with La Brea College, and they were also interested in doing something to help nurses. And then we decided that maybe podcasts would be a way to reach out to nurses to talk about self-care strategies, self-compassion, some risk factors and things that they should be concerned with, because these are unprecedented times and very difficult.
You're an Air Force veteran. You do a lot of work with veterans. What are the parallels that you see between post-traumatic stress that military members experience and what people like Shana are going through right now?
I see a lot of parallels, really. I think one of them is the camaraderie that nurses have with each other, the connection that they're basically in the battle together, just as our military veterans are. They understand each other, they're available for each other. And then they have this need to protect those around them and don't want to share those terrible things that happen at work with their loved ones. And I think that leads to separation and inability to connect, and then more stress in the time where they need to connect. It's hard for them to connect because they don't want their loved ones to see the dirty things that they have seen. And I also think that another connection is that of moral injury. I think that our military service members experience that. It's when there's incongruence about how you see that the world is, what is just and moral in the world, and then you have to do something contrary to that, or you see something happen contrary to that, or someone in charge has you, do something that doesn't match the way you see that the world should be. And our nurses are experiencing that on a daily basis.
So the world is supposed to work a certain way, in this concept of moral injury that you just articulated. The world is supposed to conform to a certain set of rules and regulations, and then it doesn't fit those, and people who've come to expect those are understandably stressed, maybe overwhelmed as a result. Is that a fair paraphrase?
Yes, I think so. And I think our nurses, they want to be able to do their job and have all the supplies that are available and needed in order to do a perfect job at taking care of all the patients as much as possible. And in this situation, that hasn't always been possible.
And as Shana said, it's not just supplies, it's protocols, right? There should be protocols in place that you follow, and then you can do your job and you can make people better. And if the protocols don't exist, you're afloat. Shana, let me ask you, it's a personal question, but it fits what we're talking about here. Have you taken steps to get help dealing with any frustrations, exhaustion, feelings of being overwhelmed or ground down that you may be experiencing at this point in the pandemic?
So my life is a go, go, go life. I don't take many times to stop and pause. Even when we were doing the podcast, between assignments, I'd take like a day off. It was very much go to the next, keep going. And as we even talk, if you don't stop and address it, it just builds up, but it's always in the background. So I never had to deal with it. Honestly, stopping and taking a permanent position and no longer traveling has been the biggest eye-opener for me as to that I need help. Dr. DeOlympia talks during the podcast about a bunch of different methods for nurses to take during the moments of those high intensity, to practice them beforehand, be understanding of them, aware of them, and then to use them during those moments. I have definitely used them. I continue to use them. One she talks about is like self-touch and just like rubbing your arm or giving yourself a hug and just having a moment to yourself and like treating yourself like you would a friend. Like talk to yourself instead of me being like, oh God, Shana, like blah, blah, blah. Would I talk to a friend that way? No. So I've used those, but as for seeking out therapy, I have to admit I have not yet. It is something I definitely will. It's something that I know I need. I have been in the middle of starting a full-time job, moving, buying a home. So I have not stopped as much as I tell myself I have. But it's something rehearing the podcast. So we did the podcast, and then when it got actually put out to the public is the first time I heard it in its entirety. And I emailed the ladies like shortly thereafter. And then after I even got my COVID shots, and I said, wow, like hearing myself in those moments, it just brings back a lot.
And I would think that, oh, sorry, go ahead.
No, it's okay. I don't want to say like a PTSD, because I always say like our military veterans do so much more than what I have done. Like I'm very proud and supportive of them. And I think their jobs are much more difficult than mine. I want to give them the respect they deserve, but it is like a PTSD of hearing what I had gone through. And then just knowing that like, I might only see 1 or 2 COVID patients now. I'm not in an entire COVID unit, but it does bring back memories of like specific patients I've worked with and things that I obviously have not overcome.
Jenny, let me ask you in closing before we wrap up. For people who have been on the front lines of this, whether it's nurses like Shana, or I would think that many of these issues apply to people in other medical professions, including physicians, are there certain cues that people might want to be attuned to that would tell them, all right, I know this is something I need to deal with at some point. I'm feeling a certain way now, or thinking certain thoughts now, and the time for kicking the can down the road has probably passed, and I should tackle this immediately?
Yeah, I think there are definitely symptoms to pay attention to. I think if you try to go back to your life as it was before, and you keep seeing that these symptoms are getting in the way of your functioning, getting in the way of your connecting with others, you're having a difficulty falling asleep, staying asleep, or you're waking up early and you can't go back to sleep. You're having, you're trying to avoid thoughts of the experience, but they keep coming back and you have to push them down. Or maybe, you even start to feel like a physical arousal of anxiety when you start to go back to the hospital or back near the location where you had the experiences. I think it's a good idea to start talking to someone so that you can get some tools to sort of bring that level of anxiety down. And I think that's an important thing to do along the way, because you need to have skills and tools so that you can not just keep working your way up that anxiety ladder, or your body will start to stay at that ladder and the bottom, it just sort of drops out. And then it becomes really hard to wait in line at the grocery store.
Yeah, I would
because
imagine.
It's so annoying. Those low stress events are the ones that then just send you over the edge, and maybe you start having anger outbursts at your friends or your family, or, when you're driving down the road, and you don't really want to do that around here.
If it gets to that point, or before it gets to that point, seek help. Jenny D'Olimpia, Shana Curran, thank you both for talking with me.
Thank you for having me.
You can listen to Unprecedented Nursing in a Pandemic wherever you get your podcasts.